Hi, everyone. I am Dr. Alyssa Wright, and welcome back to the Trimester Bubble. I'm a chiropractor and dynamic body balancing facilitator at Body and Balance Chiropractic. We support mamas, mamas-to-be, and babies by helping them live their best lives. Here on the podcast, we'll be bringing you educational content for the pregnancy journey from both us and our guest specialists. Whether you're thinking about starting a family or are already pregnant, or maybe kiddos already at home, each episode is here to help lift you up. We know that this is often a confusing and lonely time, and all of us here at the Trimester Bubble want to support you on your journey that is mamahood and raising little ones. If you are local to the Boulder, Colorado area, I'd love to invite you to our free quarterly pain-free pregnancy class. It meets in person at the Community Roots Midwife Collective, and we get together to discuss why pain in pregnancy is common but not normal. Plus, you'll leave with things that you can do at home to help you alleviate that pain. Also, you get to meet other moms and build your community. So we meet on the second Tuesday of the month at 5 p.m. for 1 hour, plus time for a little Q&A. Our next class is October 10th. So for more information and to sign up, head over to our website, www.bodyandbalancechiropractic.com. Click on the Schedule Online button and select classes and support groups. And as always, if you like this episode, please share the link to your friends and family to spread the word of the Trimester Bubble. All right, let's get into the episode. So this week's episode of the Trimester Bubble is about one of my favorite things to talk about, to work on with patients, and it is called dynamic body balancing. And I just want to, I say it in every intro, and it's something that we talk about with patients, but a lot of people don't know what dynamic body balancing is. So what DBB is what I call it for short. But what DBB is it is a craniosacral myofascial unwinding technique. And the question is, what does that even mean? So Dr. Phillips is a chiropractor that has been practicing for 30 plus, 40 plus years at this point. And she developed dynamic body balancing. So about almost 10 years ago now, I came across Dr. Carroll's work and fell in love with it. When you work with a lot of pregnancy and a lot of newborns, I quickly realized that less is more, and that the system responds really, really quickly when you listen to a body and when you ask that body what it needs. And so I began my journey of taking a few hours here and a few hours there and diving into the world of dynamic body balancing. And fast forward almost a decade, I am now one of the instructors for the technique. And at Body and Balance Chiropractic, we use it on every single patient that comes into the office. I have seen magical things happen after someone has been unwound and balanced. And so I want to take a few moments and kind of talk about what it is, what we work with, and who might benefit from this type of work. So dynamic body balancing is a craniosacral and a myofascial unwinding technique. What does that mean? Always the number one question. Okay, cool, Dr. Alyssa, but what do you mean by that? And there are two different systems that includes. So first is the craniosacral system. And we have a rhythm in our body called the cranial rhythmic impulse that pumps fluid around and through our nervous system. So I'm sure all of you have heard of your heart rate. You can put your hand on your heart and feel your heart beating. Our respiration rate, which is our inhales and our exhales, and how quickly we breathe at a resting place. And then we have our cranial rhythmic impulse, which when we are trained to feel into the craniosacral rhythm, we can also feel that pulse. And it's about 12 to 15 rounds a second. And this is what pumps the fluid around our nervous system. So we open up and pull in fresh plasma from our blood, which brings nutrients to our brain, nutrients to our spinal cord, nutrients to all of our nerves. And then it pulls the toxins out of our nervous system. So this pump is nutrients into our brain, toxins out of our brain, nutrients in, toxins out. And that is the nitty gritty of what the cranial sacral system does. And so within this work of DBB, we are tapping into that system and seeing if it's balanced, seeing if that pump is pumping the way that it should be pumping, and making sure that there aren't any restrictions along that line. And what makes dynamic body balancing extra special is we also include myofascial unwinding within that work. So it is called dynamic because unlike traditional craniosacral work, the patient is sitting up. And by doing the work in gravity, we allow the body to be able to find stuck points throughout the whole system versus no gravity where we'd be working on the head or somewhere in the body and we don't have as much feedback to the brain. So things move a little bit slower. So it's dynamic and our patients will unwind and twist away any torsion accidents that they may have had. And this can go all the way back to in utero. I am sure you guys have heard a mom who has said, this baby is stuck right here underneath my rib and they are kicking and punching and kicking and punching. Or had heard of a delivery where baby is coming down and then it's always the word stuck. And what we don't think about is that baby, if they are stuck in utero, then their little bodies are out of balance before they even make it to this side of the womb. And so I always go all the way back, talking to the birthing person, the mom, about what's going on in their body during their pregnancy. And what was that like? What was delivery like? Getting as much information as we can all the way back to figure out when these patterns started. And it gives us a really good sense of how many layers we need to unwind. So with dynamic body balancing, we have that craniosacral with the myofascial unwinding piece. And they come together to allow the body to find a state of balance. When we are doing this work, our job is to activate the receptors, and I can get real sciencey here, but I'm going to hold on to that for a later moment in time. But we activate receptors. We activate the little parts of your body that talk to your brain and tell your brain what's going on. And then the brain comes back and goes, oh, sweet. Thank you for hearing me and activating that. Let me show you what's wrong. And so it's a very neurological, brain-led process where we just tap in, activate the process, and then the patient's body does the unwinding. And it unwinds all types of things. One of the major things that we look for in our history is whether or not there was any type of torsion injury. So what does that look like? Well, it might look like a car accident where we had a seat belt on and we twist around that seat belt and get some whiplash. It might look like being a student athlete, where I know for me personally, I was a golfer and a pole vaulter and a dancer. So everything I did put rotation in my body. If you think about a golf swing, that's a spin. If you think about a pole vaulting, that's a spin. And I can't even tell you how many tens of thousands of spins I have probably done in the world of dance. So all of those are torsions and twists. We also see it a lot where slipping down the stairs, where you reach up and grab the armrail and your body keeps going. That's going to put a twist through your system. Learning how to walk and you grab onto that coffee table with one hand and you don't quite get that other hand on and you spin and land on your bottom. That's a torsion injury. So each one of these pieces through all the phases of our life can lock these patterns into our body. And then our bodies are really smart and they figure out how to compensate for it. And they reorganize here and reorganize there. So that way we look all square and perfect and upright. But in reality, we have put layers and layers of compensation patterns on top of those initial injuries. And if you're not seeing me, I'm air quoting injuries because we don't think about learning to walk as an injury. We don't think about playing golf as an injury. But all these little things that throw our body off of balance can amplify and stack on top of each other, layer by layer by layer. So that's the fun for us as facilitators to dig into what layer are we working on today? What are we releasing from the body today? And how can we make a difference in our patients' pain today? And so that's what we are looking for when it comes to what is DBB and what is that craniosacral and what is that myofascial unwinding piece. The next question that I get asked a lot is like, cool, how do I know if this is something that would help me? And that's always a great question. Like, okay, cool. This sounds interesting. This sounds like something different. How is it going to help my body? And what I always say to patients is, okay, let's go through and see where it might help. And we go through a history and talk about all of these things. At the end of the day, I'm a firm believer. If you have something that traditional allopathic medicine hasn't been able to help, if you have something where you've gone to chiropractors or physical therapists or occupational therapists and you get like 90% of the way there, but nothing seems to stick, nothing seems to hold. You're always like, I just need a little something else. Those are our favorite types of patients to work with. Of, okay, how do we get you that last 10%? What is still stuck in the body that is keeping the body out of balance? And spoiler alert, if one part of your body is out of balance, everywhere in your body is out of balance. I always explain the work with fascia. Fascia is kind of like if you've ever seen a piece of chicken and there's that white film around the outside of the chicken. That is the fascia, and it covers and intertwines all of our bones and muscles and tendons and ligaments and nerves, and it's wrapped up of every piece of our entire body. And as this is wrapped up, intertwined, those little injuries that I mentioned before come in and they're like little spiders in this web of fascia. And we get one little spider. And if you can imagine a spider being caught in a web, it changes the entire shape of that web. That little bug changes the whole shape. And so we get one little bug while we're in utero, where our arm is up by our head and not quite in the right spot. And then we come out and we have that tension in our shoulder These are my babies that come in that don't want to turn their head one way, are having trouble opening up their jaw to latch, are really, really fussy, colicky, maybe constipated. And so we have this little tight shoulder that then our bodies figure out how to compensate. And usually around 5-6 months, some of those symptoms start to lift up. But then we move into being able to crawl. And you know what? Now that little bug in the shoulder is another little bug in the hip flexor. So we have trouble getting our leg underneath us to start the crawling process. And then we start to walk and we're falling on our bottoms. And every time we hit our bottom, it's another little bug in the system. So you can see how these bugs collect. And that's where this work can be super helpful in finding those bugs and unwinding them. And that's where we see our patients getting that last little bit better. And so those are the big things. One, it is great with newborns who are dealing with all those things that I was just talking about. 2, toddlers as they're learning how to walk. 3, pregnant mamas, to make sure that your body is in balance, because if your body is in balance, it helps your baby's body be in balance. Mom in balance, baby in balance. And then 4 is anybody with chronic pain of you just can't get to the root cause of it. And so those are the top 4 people that we always talk about in our practice of how can this work help? Why is it important for me? And it is super gentle, which is why it works for every age range and every person. There is no force, there is no pushing. We follow the body with what it needs to come to balance. So, a quick recap of all things DBB. I'm sure you can tell I could talk about this for about 3 hours and really settle in, but I just want to do a little bit of a tester for you guys and like a little taste test of what goes on with DBB. So we work at balancing the craniosacral rhythm, which is how we get nutrients into our brain and spinal cord and toxins out. And then from there, we balance the fascia, which is that wrapping around everything in our body to help release any hidden tension and release what may be keeping you from getting that last 10% that you've been looking for and hoping for. And this technique is good for everyone. We find it especially powerful for newborns, toddlers, pregnancy, and chronic pain. And with all of the support of the nutrients in and out of the nervous system, it has a really calming effect on the nervous system and brings you out of that fight or flight stress place. So a lot of our patients also find that they get extra bonus benefits with their anxiety, with their indigestion, with their organ systems. The nerves talk to the organs. And so when we clean up the nervous system, we can, as extra bonus, get clean up in the organ systems too. So as you listen to this, if any questions come up, you'd love to learn more about dynamic body balancing, you can check out the show notes. We have more information on our website, and we also have more information on the dynamicbodybalancing.com website. And if you're interested in joining us and learning this technique, be sure to reach out. We have our 2024 schedules for, there are, I think, 7 of us teaching now, maybe 8, but we teach around the country. So if this speaks to you and you're like, man, I'd love to learn more, please reach out and I can help support you on that journey too. All right, everybody. Can't wait until next time. We'll see you soon. Thank you for joining us on the trimester bubble. We so appreciate your support. If you know another mama or mama to be who could use the information in this episode, please send this link to them. We also love hearing from you, so send us a message and let us know your thoughts or any questions about this episode. I'm Dr. Alyssa with the Trimester Bubble, and we'll see you soon.